Wonderful. Good morning, everyone. My name is Mona Aika, and I'm a child protection specialist for UNICEF East and Southern Africa Regional Office, ESARO. A warm welcome to all colleagues from UNICEF offices, but also to government representatives from East and Southern Africa who have managed to join us this morning. This webinar is being recorded. And again, just a quick reminder to all participants to put yourselves on mute. And if you haven't done so already, kindly introduce yourself in the chat box. Thanking all participants that have already.
Mona.
Can you hear me? Can you hear me? Emily?
I can hear you perfectly, Mona. Can others hear Mona?
So maybe
It's maybe because
No, I can't hear.
sorry?
Ken can't hear you. So Megan's saying, yeah, others are saying that they can hear you. Ken, are you sure you're in the English channel?
Yes, I'm in English channel.
Okay.
And
Sorry. Why unmute the original?
Try unmuting the original audio. That might help. Mona, are you in the English channel?
I'm checking again. I did put myself in the English channel. Just hold on.
Mona, I can hear you now.
Okay.
You can hear me.
Okay.
Yes.
Thanks, Ken.
Thank you.
Sorry.
I'm still audible, right? You can still hear me.
Yes.
Okay,
Yes.
Wonderful. So I had just started off by welcoming everybody. Wonderful. Thank you, Charles, for that confirmation. Welcoming everybody to this webinar, and a warm welcome to all the government representatives who have managed to join us this morning. My name is Mona Aika, and I'm a child protection specialist for UNICEF East and Southern Africa Regional Office. I'd also just explain that this webinar is being recorded, and the recording will be shared afterwards. But also reminding participants who haven't done so already to introduce yourselves in the chat box. Thanking all of you that have managed to introduce yourselves, but we need to know your name for those who haven't yet done so, the country and organization that you're working for in the chat box. This helps us to know the coverage of this webinar, the reach. You're also reminded to mute your microphone because for us to be able to hear each other. And also a reminder that we will have a Q&A session, but in the course of the various speakers and presentations, if you have a question, use the chat box again to type your question in that chat box, and we'll ensure that we address that question. But during the Q&A session, use the raise hand button to raise your hand, and of course, you'll be given an opportunity to intervene directly. All the PowerPoint presentations that are going to be used in the course of this webinar will be shared in a Google Drive folder. And of course, Emily will put this folder in the chat box if not done so already. And also, as it's been explained earlier, but if you're joining us right now, we have interpretation services. So remember to click, the instructions are right there. Hover over the bottom of your screen, click interpretation, choose your language, whether it's English or French, and also select mute original audio so that you can actually hear the interpretation. Lastly, we will provide more information and updates towards the end of the webinar. The webinar is designed to be 1 hour and 30 minutes long, so I hope you can be with us throughout the webinar. And now, without further ado, I would like to pass the floor back to Emily, who is the consultant of Child Frontiers, whom UNICEF ESARO have hired to help us with the administration of this platform, but most importantly, to also organize the various topics being discussed and also the publications that have been produced. All this is done by them. And before I close, I want to remind everybody, if you're joining us for the first time today, this learning platform was designed by UNICEF ESARO in collaboration with Changing the Way We Care back in 2019. And now we're in phase 3 of the learning sessions that's going to run up to September of this year. And we are also fundraising to ensure that we have a continuation. This platform was made possible by the generous support of USAID partners, and we are very thankful and grateful to them. Now, without further ado, I'm going to pass the floor back to Emily. Over to you.
Thanks so much, Mona. So today's webinar is going to be looking at care leavers in Kenya and some research that was commissioned by UNICEF and the government of Kenya and carried out by Child Frontiers on the experiences of care leavers in Kenya. So I'd like to call on Mr. Kennedy Owino from the National Council of Children's Services to introduce the research and explain why this research was carried out, perhaps linking us back to how it fits in with Kenya's fantastic national 10-year care reform strategy. So over to you, Kennedy. If you're able to put your video on, that's fine, but I understand you're on the move, so you might not be able to.
Thank you so much. I hope everyone is getting me clearly.
We can
Yes,
hear, we can hear you perfectly.
Yes, I'm Kennedy Owino. Kennedy Owino works with the National Council for Children's Services, Standards and Compliance Office. This is also the part of the directorate that is dealing with issues of care reform and coordination, plus other departments within the agency. Now, Kenya started or initiated the process of transforming care back in the year 2014, but at that time we were promoting alternative family care. Now with the global shift, in 2019, we embarked on what we call now the care reform. The first step was to develop a care reform strategy, which was a very consultative document, consulting various agencies, both state and non-state, just to draw a clear roadmap on how we are going to conduct care reform or implement care reform in the country. One of our key respondents by that time was the care leavers in Kenya, because we wanted to have a live experience on what they were going through. So when we conducted interviews with stakeholders, including care leavers, when we were conducting interviews with them, we realized that there were gaps in information on challenges faced by care leavers as they were exiting residential care. And therefore, it became a challenge to really know all the needs that needed to be addressed before they leave and after they have left the residential care. So the strategy then recommended that there is need to conduct a research to understand more on the areas of the policy and programming for care leavers so that we can address the shortcomings that were identified during the interviews and interactions with the care leavers. So in Kenya, the study focused on care leavers who had left institutional care as adults or children. Yes, we understand that in the normal scenario, institutional care for children in Kenya is supposed to be for children, but for one reason or another, you get adults that are under institutional care. So when we were looking at care leavers, we were focusing both on children and also adults, also to understand why they have stayed there for long. So the study did not focus on care leavers who had been in family-based or community-based arrangement, but we were focusing on those that had just left the institutional care. So we didn't really focus much on those that had left sometimes back and now were in the family and community-based care. That means there are those care leavers that had been placed in families and other forms of alternative families, but we were focusing on the ones that were purely on residential care. What was the purpose or the objective of carrying this?
Oh, I'm sorry, Kennedy. I think we're losing you a little bit. Perhaps yeah, I think we've perhaps Catherine, Kennedy, I'm afraid we can't hear you, I don't think.
First of all, to generate and stress of children and young persons. Are you getting me now?
We're getting
Hello?
you now. Yes, we're getting you.
Are you getting me now?
Yes.
Oh, thank you so much. So
Yeah.
I'm saying, what was the purpose of this study? We wanted to get and generate and strengthen evidence-based on the level of preparedness. So how are we prepared?
The line is breaking up.
Yeah, so sorry, Kennedy. I think we might have to switch over to Catherine. Perhaps you could step in and just take over for this bit. Would that be okay? I know. Yeah, Kennedy, I'm so sorry. We can't hear you.
That was one.
Kennedy, I'm so sorry. I think we might.
We wanted to identify the challenges and experiences that caregivers that had left institutional or
Kennedy,
residential care.
Kennedy, I'm so sorry. I think we might have to leave you and ask Catherine to step in. No, the line quality is not good. Perhaps Catherine could step in for this bit now. I'm so sorry. I just think there must be a problem with the line. Catherine, would you be okay to take over, to step in just to finish off this part of the presentation? Thank you so much. Thank you, Kennedy. I'm sorry about the technical issues.
Okay, sorry for that. I will take over because Kennedy is on
Catherine,
transit.
Yeah, perhaps you could introduce yourself as well. Sorry, I didn't do that.
Okay. Okay, thank you. My name's Catherine Kimodo. I'm a child protection specialist working with UNICEF Kenya office. And within this particular research, I was part of the technical working group together with government that worked with the consultant to do the research. So as Kennedy was saying, he had mentioned that we wanted as a country to generate evidence-based information on the level of preparedness for children and young people as they exit residential care, and also to identify the challenges and experiences from the caregivers themselves they face as they reintegrate back in the country, I mean back to the family and community, and also to use this finding of the study to develop communication and advocacy messages for various audiences within the country, and also to inform, the findings would inform evidence-based supported intervention policies and programs for successful preparation of children from institutional care back to families. I think I just also wanted to correct one thing, that the study did not just focus on the caregivers who left immediately the study was conducted, but also those who had reintegrated back to communities longer period, but that will be handled by our researchers. We also wanted to look at the existing opportunities within the government, private sector, and civil society organizations where caregivers could be linked and engage in programs that would address their needs, various needs, including the psychosocial well-being and economic capabilities. So there was a lot of engagement with the government and civil society organizations and private sector, just to see what are the opportunities that they can be linked with, and also to look at areas and how the caregivers would be engaged in the work of care reform in the country. And I think that one I've mentioned. And so the the research was conducted by Child Frontiers team, who will now give us the findings. Thank you.
Thank you so much, Catherine and Kennedy, and apologies once again for those technical issues. I'm going to
Thank you, Catherine. Thank you, Catherine, for that support. That tells you that in Kenya we work as a team.
Yes.
Thank you so much.
You do. That's fantastic. Thank you, Kennedy. So I'm now going to hand over to Ken Ondoro and Bertha Lutome, who are part of the Child Frontiers team, who carried out this research with care leavers. So over to you, Ken, and they're going to present the research findings, but also explain a bit about some of the innovative peer-to-peer methods that were used in the research. Thanks, Ken. Over to you. If you can just put your put it on the slideshow view, that's brilliant. Thank you so much.
Yeah. Thank you, Emily, and thank you, Kennedy and Catherine, for that introduction and giving a background to the study. Now, my name is Ken Ondoro. I'm a researcher with the Child Frontiers, and I led the team in country that conducted this study. I will just start by talking about a brief about methodology, and then I'll invite my colleague Bertha to take us through the peer-to-peer method that we employed in this study. So the study generally used a mixed methods approach. And that means that we had some aspects of quantitative and some aspects of qualitative approaches employed in this study. So on qualitative, we used peer-to-peer approach. We conducted FGDs with children who are still both in the institution and care leavers who had exited the institution. As Catherine had mentioned earlier, that we talked to a group of care leavers who had transitioned into the community and reintegrated into the community. And we also conducted key informant interviews with key stakeholders, including NCCS, DCS, UNICEF, and other key stakeholders in the care reform sector, not forgetting CCIs, charitable children's institutions in the country, that we also interviewed the managers, and we also conducted a survey with them. So on the quantitative component, I've just to mention that we conducted a survey with the managers of charitable children's institutions here in the country. We sampled a few and shared a tool through an ODK platform, and they responded to that. So that is the background of the methodology, and the strength of this study lies in the peer-to-peer method that we employed. And I'll invite Bertha to briefly take us through the peer-to-peer method. Bertha.
Thank you so much, Ken. Good morning. Thank you, Catherine and Kennedy, for taking us through the first phase of this study. My name is Bertha Lutome, and I am a care leaver from Nairobi, Kenya. I took part in this research that was funded by UNICEF and guided by the government of Kenya. And so I was the peer researcher and was privileged to conduct research in 2 counties, that is Nairobi and Garissa County. And so being a care leaver, I had vast experience, and I will say I had an interesting time interacting with my fellow care leavers from different parts of the country. And so I will take you through the strengths of the peer-to-peer research method, especially when it comes to care reform. And the first strength was that the respondents opened up easily. And this is because there was shared experience and empathy. So before we started conducting the research, I took them through the guidelines and procedures that were put in place. And then I also explained to them that I am a person with lived experience, having stayed in a residential care facility for close to 7 years. And so having shared with them some of the challenges and strengths that I experienced while in care and even after I transitioned to kinship, that helped them to actually open up easily compared to when they're interacting with a researcher who doesn't have personal experience on matters care reform, or rather having stayed in a residential care facility. And then the biggest advantage that I will say when it comes to using this method is inclusive and empowering. And so by this, I mean that this type of research method actually promotes meaningful participation. And so when you involve caregivers to participate in research or studies that involve their experience, you actually help them to create that sense of belonging. And then since they also have the experience, they feel like they are involved in the process and therefore they are able to give it their best. And one thing that I understand when it comes to creating social and behavior change, when you want to implement behavior change, you need to, first of all, sit down with the people who have been affected by a particular behavior. And then after that, you develop solutions with them. And at the end of the day, you walk them through the process of implementing the solutions that you have created together. And so by involving caregivers in the study, you'll get to understand the real challenges that they are experiencing, or rather the real challenges that fellow caregivers are experiencing. And therefore, chances are high that you as a researcher will come up with a report that has a lot of information that is not subjective. And then the other advantage that I realized was the peer-to-peer method actually builds trust between the respondent and the researcher. And as I had explained earlier, just talking to them and explaining to them the experiences that you went through helps them to trust you more, since you act like their big sister or their big brother. And so the biggest advantage that I found in this was that it actually made the snowball method of data collection easier. And by this, I mean, whenever I wanted to get other people with lived experiences from different orphanages, the people that I had talked to first will easily link me up with their friends. And so I will say that made the data collection process easy for me, especially in Nairobi and Garissa counties. So we actually acted as if we have created a small community of caregivers who are willing to give their feedback in regards to their experience. And then in that regard, the process was also flexible and informal. This is because most of us were actually age mates. And so it was easier for us to comfort each other, especially offering advice to those who are younger than us. I met young caregivers who are in college and will want to pursue, let's say, social work. And so it was easy for me to just talk to them and offer them advice in regards to what they're expected to do and how they can achieve their career, you know, the power of believing in themselves. And then the conversation will go on and on and on. And at times I will take up to 2 hours talking to one person. The conversation went on, it became interesting and emotional at the same time. And so the other advantage that we experienced was that there was easy follow-up. This is because, as I had stated, we had created a small community of caregivers who were willing to take part in the research. And so after the research process, it's actually easy for me to follow up with those that I interviewed, just to know how they are faring on, especially their mental well-being, and also those who are in school. And I would say we managed to link up with a caregiver from Garissa County, and they did not know about the existence of a network in Kenya that advocates or rather supports caregivers, and that is the Kenya Society of Caregivers. And so having done that, it was easy for us to just contact the person in charge and request her to probably mobilize other people, other caregivers in Garissa, so that they can join the group and get to learn more about the challenges or how to overcome some of the challenges that caregivers are experiencing. Next slide, please, Ken.
Sorry, I'm trying to scroll. Oh, there you go.
Okay, thank you. So despite the many challenges, the many strengths that I experienced during the interview process, we also had some weaknesses. And the first weakness that came about was that some respondents feared sharing their experiences. And it will take time for me to explain to them the reason why we are conducting the research. And one of the main questions that came up across the counties that I visited was, what am I going to benefit from this research? And some of them told me that they have shared their experiences over and over again to different researchers. But when you look at their life 5 years, 10 years down the line, their life is still constant, whereas the lives of the people who conducted the research on them probably has improved. And so I want us to put that into consideration when involving caregivers. It is important to come up with long-lasting solutions that will probably make their lives better and not leave them at a bad state. And then there was also fear to share information because, again, the challenges that they have experienced initially because of having to tell their stories. Some of them have been betrayed or have also been manipulated, and the stories that they shared with some people actually was used against them. And so there was that fear, and it actually took time before we built trust. And I actually acknowledged and respected the opinions of those who were not willing to share their stories with me. And then the other major weakness was emotional breakdown, especially during the interview. It actually felt like I was pricking fresh wounds, because when you listen to the stories that the caregivers shared were actually emotional, and some of them will actually break down. I remember an incident whereby one of them told me that he was kicked out of the residential care facility and was linked to a fake relative. And life outside there wasn't easy for him. And so when he contacted the orphanage to tell them that this is not my relative, the orphanage requested him to stay. But I understand, I think the preparation phase wasn't done clearly. And the sad thing is that that young man actually knew that he had a grandmother. And so having linked him to a fake relative and forcing him to stay there was actually a challenge. And so at times we will cry together, although you don't have to really show them, you have to be there and offer them support. But my recommendation in regards to offering emotional support and ethical considerations while conducting this research on people with lived experience is that researchers need to be considerate of their emotions, at least give them time to compose themselves. And then after that, feel free to link them up with a professional counselor. We'll offer counseling services to them so that you do not leave them with the wounds that cannot be sealed. And then the other challenge that we experienced was that the weakness of using this method is that it encourages subjectivity when it comes to data collection. So I mean, I'm a caregiver. I understand the challenges that we faced, and probably the challenges that I faced are better or worse than another person's experience. And so while conducting a research, I will definitely I will be forced to lean on one side. I will be biased and therefore present the negative side of residential care, forgetting the positive side. You know, while we were conducting the research, we noticed that some people actually had a good time in the orphanage, while others had, majority of them did not have a good time while staying in the orphanage. And so since my experience was not good, I would be tempted to write the negative side or have the negative side in mind while submitting the report for the research findings. And so that becomes a challenge. And you know, when conducting research, objectivity comes out first. And then the final weakness that we encountered was potential power dynamics. And this unfortunately can apply to we as caregivers. You know, while conducting a research, you have the power over the respondent. And so you understand clearly what is expected out of you, from the research. And so chances are high, you might lead the respondent to give feedback or their experiences based on your expectations. And so that limits the respondent and might at some point make the respondent feel as if they're looked down upon to. And so, as we say again, it is important to be considerate and just give the respondent time to share their experiences, whether positive or negative. And then from that, you can pick out what you feel fits the purpose of the research study. And to my recommendation, although it is not here, I would encourage the use of this method, especially when it comes to matters care reform and also engaging caregivers. Thank you so much, Ken. I take it back to you.
Thank you, Bertha. I think just to add that when we talk about peer-to-peer method can be employed in any study. It's a participatory method where people with lived experiences, so it can be any lived experiences, it doesn't have to be caregivers, are encouraged to be part and parcel of that study. So they can be used to design, they can be used as researchers, they can be used in data analysis and reporting. And it's a good approach that empowers those with lived experiences. In terms of findings, I think I'll speak about 5 main findings for this study. And one of the findings is that most of the children in the CCIs that we interacted with were not total orphans. So they either had one or both parents and or relatives back at home or where they came from. And we learned that there were 2 key push factors for children going into the institution. One of them was poverty, but the main one was education. So even parents were finding a way of their children getting into the institutions for the sake of accessing education. And because these institutions offer sponsorships for these children, then parents found it important that their children go into the institution to access education. The second thing was generally poverty in the sense of lack of food or looking for accommodation. And we also found out that these children in the institution had very little or no contact with relatives. There are those who, as Bertha has mentioned, were either linked to fake relatives, but there are also those who did not have any contact with a relative or anyone they knew outside the institution until they left the institution. The second finding that I'd like to speak about is the shift in policy among many of the CCIs that we interacted with. So if someone is speaking.
Just give me 1 second and I'll sort that out.
Sure.
And discuss it.
There you go.
Thank you, Emily. So there are also shifts in policies among many of the CCIs that we visited. So one is that most of them no longer kept children up to the age of 18. So children were mostly exited at the age of approximately 14 years. That is when they just completed class 8 and they were transitioning to secondary school or high school. Then they would be, most of them would be reintegrated back into the community and then supported while at home or while in the community. And we observed this in almost all the CCIs that we visited, that most of them were actually reintegrating children at class 8 and they would be supported while in the community. And the main support was on education. So there are some institutions that provided more than just education, and we'll come to that when we talk about some best practices. But most of the institutions supported these children in communities in terms of education. The other aspect that I'll just touch on is that having discussions with the caregivers and even the managers is that there were some perceived positive aspects of care. And most of the caregivers said, yes, we are provided with basic needs, food, shelter, and clothing, provided with educational opportunities, majority of them. They also talked about having brothers and sisters to play with and interact with, and exposure to multicultural environment, where some of them talked about even visitors from other jurisdictions outside the country coming in and interacting with them. In terms of negative aspects of care, the issues of confinement, or lack of contact with the outside world, I think that was the main issue raised by most of the caregivers. And, you know, some of them even described how they left care, saying that, you know, I was told that you will leave tomorrow, or your time is up tomorrow. Some of them would be, you know, told just a few hours and told, you know, you're supposed to leave because you've turned 18. But then they didn't have contact because they were not interacting with the outside world, so they didn't know where to start from. The other aspect of it is loss of family and parental guidance or support and love. I think that is quite clear. When you're confined, then you lose that. A lack of attachment with a consistent caregiver because of the nature of institutional care, and sometimes there could be, you know, because these caregivers are employed, and so there could be a caregiver turnover, someone new coming in, and so there was lack of one child being attached to one caregiver. There are issues of maltreatment or abuse that also some of the caregivers talked about, you know, issues pertaining to physical abuse, verbal abuse, amongst many other abuses that they talked about, issues of neglect, and most importantly, lack of social skills and life skills. I think this lack of social skills and life skills and lack of contact with the outside world were the main negative aspects of care that were raised by by caregivers. And I think we'll delve deep into that as we move along. And the other aspect is that
L'autre aspect,
yes, Emily.
No, that wasn't me. I think that was maybe a little glitch in the interpretation or something. Go ahead, please, Ken. Carry on.
Thank you. Thank you. So we also learned that challenges or some of the gaps experienced in terms of care for children while within the institutions were also a source of difficulties faced after care. For example, attachment issues, feeling of rejection, insufficient guidance, love, and social skills. I've talked about all this in social capital. So being confined and not exposed to the world outside the institution then meant that even creating relationships, be it professional relationships, be it friendships, be it romantic relationships, then became a problem or a challenge to these caregivers after exiting care. Let's talk about care leaving, which was, I think, the main aspect of this study. We found out that there was gross inadequate preparation of children aging out of care. And none of the CCIs that we visited had an exit strategy, at least a written exit strategy. When we spoke with them, when we interviewed them, some of them mentioned that they do have an exit strategy, but when we requested for the document that outlines an exit strategy, it was not there. Some of it was social bias, as a result of social bias, because they knew what we wanted. But in our discussions with the stakeholders, some of the CCI managers, the caregivers, and even children who are just about to exit these institutions, there was no preparation in terms of exit. And by preparation here, we mean also the participation of the child who is just about to age out of care, being part and parcel of this preparation. So most of them told us that they were just told to pack their bags and leave, not being chased away. So don't misquote me, but they were not informed in good time that they will be leaving care at a specific period of time. Some of them were informed 1 week prior, but some of them also talked about just days. Some of them even talked about being lied to, being told that you're going to live with so-and-so who is a relative, and then you will come back to the institution, only to find out later on that they would not be allowed back into the institution. So that aspect of preparation was one of the biggest gap that we identified in this study. So as I've mentioned, children were rarely involved in discussions about their future beyond the CCIs. That was never there, even though there are also a few institutions that, for lack of a better time, tried to prepare these children just by telling them, when you turn 18, then you are not supposed to be in this institution. Or when you get to class 8, then we'll reintegrate you back home. But most of them, even for those who are reintegrated back after class 8, learned through observation, because they would see their peers within the same institution being reintegrated back into the community when they, at 14 years, or approximately 14 years, or when they reach class 8. Little effort was made to mentor these children, as I've mentioned. I think I've talked about the lack of planning and preparation, and this was mainly the source of most of the challenges that caregivers experienced post the institution because there was no preparation at all. They talked about not only lacking social skills and life skills, but lacking contact. Like, where do I go to from here? And that had a multiplier effect in most aspects of their lives, be it social, financial, emotional, and psychological aspects of their life. And you can see from the presentation that some of them felt isolated, fearful, because they are not used to the outside world. Issues of self-esteem emerged prominently in this study. And we'll also share some of the best practices here. And I'll talk about associations like KESCA that emerged as one of the groups that supported these care leavers with some aspects of life skills and providing psychosocial support for these care leavers. Now, these are some of the quotes, some of the verbatim quotes from the care leavers. And if you allow me, I will read them as they are. They told me one evening, alongside others, that we will go home the next day, and even told us to pack our bags immediately. After that, they checked our bags to ensure that we didn't carry many clothes with us. I felt so bad. And because I knew the challenges that we were facing at home. The next day in the morning, my dorm parent gave me transport to go home. And that was it. They just said, we need to go and know our relatives at home because we are done with Form 4, and that they would call us when they get money to take us to university. I think I've talked about that, sorry. So let's talk about support system for care leavers. I think that's the last finding that I'll speak about. And I think there are more verbatim quotes, 2 or 3 that we'll go through before the end. But we also learned that there was very minimal support for care leavers after leaving institutional care. And I've mentioned that those who exited at class 8 were mainly supported in terms of education. And most of the times, those who left at Form 4 had to fend for themselves. Most of the support was largely informal, mainly through friends, relatives, peers. And just to emphasize that peer support played a very important role in terms of supporting these care leavers in almost all aspects of their lives. That is what emerged from this study. Fellow care leavers would provide financial support, would provide emotional support, they would provide accommodation, and in most cases, they would be the first and sometimes the only contact that these care leavers would have upon exiting the institution. Well-wishers and peer groups. If time allows, we'll talk about that as well. There are some counties where we went to, for example, in Kilifi County, and I think Kisumu County, where there were these care leaver peer groups. And those peer groups played a very important role in terms of not only providing support, but providing socializing opportunities for these care leavers. In fact, in one of the peer groups, some of them were even shared how to go about dating. Sorry, I'm trying to. So you can see a verbatim quote there. My grandmother has always supported me financially when she can, and also emotionally. there was some government support system that, support initiatives that existed that we came across in the counties that we visited. Some of the care leavers accessed bursaries, some accessed casual jobs through Kazi kwa Vijana initiative. Kazi kwa Vijana is a government initiative that provides opportunities for the youth to engage, in most cases, casual labor, vocational training opportunities through TVET. And some of them formed groups and accessed funding through Youth Fund and started their own businesses. For example, in one county, there was a group of care leavers that had started a chicken farm, and they had received funding from the Youth Fund initiative. Formal support was mainly from Changing the Way We Care initiative in Kisumu, in Kilifi counties, the two counties mainly. And in Kilifi, organizations like Kesho Kenya and CICC played a key role in terms of supporting care leavers, and they provided both psychosocial as well as financial support. And they also trained care leavers on business, and sometimes provided some capital for these care leavers to start business. ICS in Kisumu also played a key role in terms of supporting care leavers. Also taking them through training, capacity building, and all that. Associations like KESCA, I have mentioned that KESCA has also been instrumental in terms of providing, they call it a home for these care leavers, but most importantly also providing psychosocial support and even counseling support for these care leavers. Tahili, Leaping Gaps program, and some CCIs. Sorry. Thank you, Timothy. So some CCIs, such as SOS Children's Villages, also.
Ken, the acronyms. There are too many.
Thank you.
Good say full.
All right, thank you. So, so I was just saying that SOS, some charitable children's institutions such as SOS Children's Villages supported care leavers even after they exited care. And some of the care leavers talked about being supported to get accommodation, being supported in terms of trying to find employment for them. They also linked the care leavers who are just exiting the institution with the older care leavers who had just left, and they called them, they encouraged the fresh care leavers to go and, you know, live and even learn from care leavers who had exited care before them. So best practices, as I've mentioned, some institutions encouraged contact with families and communities, tried to prepare children just before they exit, tried to support families through businesses, through training in terms of business, and through giving them some capital to start business, so that these children are better cared for at the community level or at family level. I've talked about, I think, in terms of transition phase, some of these institutions supported care leavers to access higher education or to access technical training. And I've also mentioned about employment opportunities. So just as a finalize, let me just read to you some of the verbatim quotes from the care leavers. The first verbatim quote there: care leavers need psychosocial support, even more than financial support. The government, charitable children's institutions, and non-governmental organizations should ensure that care leavers are supported emotionally and psychologically during the transition period. The second one there, I think that these people need to be counseled. You know, they spent most of their time in the orphanage. They wanted someone to listen to them, but they didn't get it. There was a gap that was left somewhere. They need to go through counseling sessions so that they heal fully. If they get someone who can tell them that this is part of life and everything will be okay, they won't feel bitter. The government needs to offer counseling sessions to them and also ensure that the procedure of leaving the homes is done in a good way. Chasing someone from a place where they are used to staying is not good at all. The last one there, we need people who will mentor us and walk us through life when we leave the home. We need guidance on how to make decisions. And apart from that, the mentors will also act as people whom we can lean on when we are in need. You know, most of us get depressed and we don't have people we can share the feelings with because we have fear of the unknown. We don't know how they will judge us. Thank you. Back to you, Catherine.
Thanks so much, Ken. That was a wonderful presentation. I think we're going to go back to Catherine and Kennedy now, just to tell us a bit about how the research findings are going to be used by UNICEF and the government of Kenya. Over to you.
Thank you, Catherine. Are you getting me now?
We are. The line sounds like it's still a bit problematic, but let's give it a try.
Yes, are you getting me now?
Yes, yeah.
Thank you. Thank you, Ken, for that wonderful presentation. It is a true reflection of what the research revealed. Catherine Kimodo, please share the screen. Yes. So from that research, the government and all stakeholders in the sector learned a number of lessons.
Oh, I'm so sorry, Kennedy. We are not getting you clearly enough.
We are on implementation. Are you now getting me?
Let's give it one more try. Otherwise, we'll have to ask Catherine to step in. I'm so sorry, technology's letting us down.
Are you getting me now?
Let's give it one more try and then we'll go ahead.
Are you getting me?
Yes.
Go ahead, yes.
Thank you. I'm saying from that research, we learned a number of lessons as government and also all other sectors all other agencies in the sector. And some of things we learned or the gaps we identified is already being addressed. Some of them are our next steps of actions. I will start with one of the key findings, that the number of children were not properly prepared. You see, in Kenya, when we started the issue of care reform and the exit, we are even moving from the term exit to transitioning and reintegration, because exit is a one-off thing. And when COVID struck the country, there was a directive that children who are in institutional residential care as well as schools were to leave, so that we reduce the capacity within these facilities. And there was no clear strategy on how to do that. You know, people were shocked and it was like a directive. So most of the care leavers that maybe ought to have been that were interviewed were those that they were just told, we have a direction from the government, that leave institutional care, So they were not prepared. But after that, we have developed what we call case management for reintegration. This is a step-by-step guide on what processes, what steps needs to be taken into consideration before a child is released from a residential care. So it calls upon the caseworker, the case manager to do assessment, the child assessment, the family assessment, preparing the child, going through counseling, and identifying the needs and matching them correctly so that it is a
Okay, Kennedy, we're losing you again, so I'm going to
a
ask.
one-off thing. Also presented a lot of learning and government. I'm getting you very clearly. You are getting me?
No, I think we're losing you again. So I'm just going to ask Catherine if she would mind just stepping in again, just to finish this one off. Sorry
Now,
about
are you
that,
getting me?
Kennedy. No, we're not. We keep losing you. So I'll just ask Catherine to step in and take over, if that's okay. I'm really sorry that
Hello,
the technology is letting us down.
Hello, Catherine. Hello.
Catherine, please go ahead. Catherine, I can't hear. Catherine, do you want to go? I can't hear you at the moment.
Hello?
Yeah, go ahead. Please go ahead. Yeah.
Yeah, sorry for that once again. And I'll just go through the presentation we had done together, but I know Kennedy was talking about the transition guidelines we are having, plus the case management guidelines on reintegration that the country is emphasizing on for every charitable children institution. But I must say that we have over 800 charitable institutions. So while the journey has begun, I think it's going to take time to reach to all these charitable children institutions. But the other steps that have been organized, among other things, is one, this study has not been officially launched, which is a government protocol process. And with a number of other documents in the coming months, we are looking at least by the end of August, we have the study in the public domain. But it's been used. The report is being disseminated, especially for personnel in residential care, wherever there is sessions that are happening, because there are quite a number happening now that we are doing the care reform strategy implementation. It's clear that within the structures of implementation of care reform strategy, that the care leavers will need to be part of these structures, especially in the technical advisory committee and the committees within the counties and sub-counties. And the strategy has also recommended a council for children and young person. Then in some counties, Kenya now has started implementing the care reform strategy that has been expanded. Initially, we had 3 demonstration counties, but now with support of partners, we are in 11 of 47 counties. And one of the areas that the Directorate of Children's Services is looking at is ensuring there is support for establishment of care leavers support groups. And so we are hoping if this is done, it's going to help and bring the issues even more clearly. We have, I'm aware that the NCCS and also overall the Ministry of Labor and Social Protection, where Children Matters fall, have started a discussion with the ministry in charge of youth on opportunities that are existing on youth empowerment and how to include the caregivers. So that discussion has started, and it is not only for caregivers alone, but also for older children and youths in the street situation. The government of Kenya has put a number of empowerment programs for young people. And so that discussion following the finding from this document is being followed up. Also with the social protection program of the government, at the moment, the criteria the government uses to provide cash transfer programs is household based. And there is ongoing discussion of expanding this criteria to include young people who are not in household, but are in institutional care. We do have within the social protection program of Kenya, what we call enhanced single registry for vulnerable population. And discussions have started with government, supported by UNICEF Child Protection section and social protection section, plus our colleagues in WFP on how to expand and to make this very inclusive. Also, again, we are developing a monitoring and evaluation framework, which is just about to be concluded. In fact, early this week, we were validating this framework, and we included indicators to monitor progress for caregivers and to see whether, to ensure that they are not left out during the care reform process. And also there are plans to have an online training course for care reform in Kenya, so that as many government and civil society officers can access this, and there will be a component on caregivers within that. Again, these are plans, they are next steps, and more will be done. I think one of the important thing is the engagement beyond Department of Children's Services and National Council of Children's Services. Reaching out to the Ministry of Youth is big, and the issues of counseling, you've seen that came out very strong. And again, moving forward is sharing this report with those who are implementing the care reform program. Before I say thank you, I also wanted to just comment on the finding that the peer-to-peer methodology. I just felt that the issues around emotional breakdown by the caregivers is not more of a weakness, but a lesson learned. And it's a lesson learned as we engage this particular methodology, but I'll let child volunteers respond to a number of questions that have been asked. Thank you so much, and we are open to receiving recommendations we can add in the next steps. Thank you.
Thank you so much, Catherine. Thank you so much. That was a great summary. I'm going to come on to the questions in a second. I just wanted to explain, in case there was some confusion, that Bertha is playing two roles today. One is the peer researcher, but she is also our project assistant on the learning platform. So you'll see lots of messages for her in the chat box as a result of that role. Okay, so Bertha has very kindly summarised the questions. I'm going to group some of the questions together. Catherine, would you mind just stopping sharing your screen for a second so we can see people a bit more clearly? That's brilliant, thank you. So the first couple of questions I'm going to ask are very simple questions about the research process, which was, could you tell us how many care leavers were involved in the research, and also when the research took place? Perhaps, Ken, you can take that question.
Sure. So the research took place between March and I think either June or July 2022. Yeah. So in terms of who participated in the study, I think I can give you a very quick breakdown. We had a total participants of 403, boys and girls preparing to leave care, 74, young men, women who had just left institutional care, 47, CCI managers, 12, policymakers and practitioners, 13. We conducted an online survey with care leavers and CCIs, charitable children's institutions, sorry for that. We had 195 care leavers through the online survey and about 62 charitable children's institutions managers responding to the online survey. Thank you.
Thank you very much. Okay, so there were two questions around sort of some of the ethical concerns around involving care leavers in research. So perhaps Ken and Bertha, you can both speak to this. The questions were around whether there were any risks of care leavers being triggered or re-traumatized as a consequence of engaging in the research, and what the research team did to mitigate some of those risks, and if any psychosocial support was provided. And sort of linked to that, I guess, whether there was any follow-up after the research, whether the findings were fed back to care leavers or they were debriefed at all on the findings. So, don't know. Ken, if you want to start, or Bertha, you want to start? Yeah, you go ahead, Ken, and Bertha can add.
Sure, sure. Thank you, Emily. I think ethics is very important in all aspects of research, and so we took keen consideration for that. The research methodology and approach went through the IRB ethical approval process. So we got an ethical approval process from a university before commencing the study. And in line with that, we developed a safeguarding framework for this study. So we kind of anticipated some of the risks that would be experienced by care leavers by participating in this study. And one of those risks were, kind of emotional breakdowns, or just a caregiver recalling the experience and getting emotional. So we were prepared for that. Our safeguarding approach were twofold. One is that in any case a caregiver breaks down in the process of the interview, we are ethically obliged to first and foremost stop that interview. And number two, support the care leaver to the extent that we can. So that could be one, engaging in a discussion that tries to distract the care leaver, or let me say the respondent, and empathizing with the respondent as opposed to crying together. So we empathize with the respondent, we try engaging in a discussion that would distract the respondent. Secondly, we are also ethically obliged to link the care leaver to a support system going forward that maybe would support them, heal if it was a trauma or something. So we did that in that process. In terms of follow-up, I think we engaged not every care leaver in this country, but at least the people we interact with were engaged throughout the process. As Bertha has mentioned, that the relationship she created with the care leavers at the county level made it easy for her to kind of follow up, just to try and find out how they are doing, and also linking them up to KESCA. I know Garissa County, the care leavers in Garissa County were not even aware of the existence of KESCA. It is through the study that they became aware and were linked to KESCA.
Just to explain.
I think that answers the question. Thank you.
Yeah, thank you. Just to explain it for the non-Kenyan audience, that KESCA is the Kenyan Care Leavers Association, and it's a very strong care leavers association in Kenya that we're able to kind of support the process. Okay, thank you so much. Bertha, did you want to add anything else to that answer?
Yes, sure. I wanted to state that in terms of follow-up and support, I'm happy to state that I'll give an example of Garissa County as well. There is one dominant organization that deals with children. And so there's this one care leaver that I was talking to, and she told me that she has managed to secure an internship opportunity at that organization. I'm sorry, I cannot remember the name pretty well, but I can share that on the chat box. But that is one major achievement. She has studied social work. And so I think she managed to secure the internship after we visited Garissa County. And I know that Ken is well known by UNICEF officials in Garissa, so that made it easier for her. And then again, we also experienced some emotional damage during the interview session. And there was this one time when we visited one CCI in Nairobi, and they dealt with the young children who are barely below 15 years of age. And after they explained to us the challenges that they are facing, especially when it comes to reintegration, some of them are taken home, whereas the environment is not very safe for them. And so we had the opportunity to speak to one of the caregivers in the organization before we left that day. And we just explained to her about some of the challenges and things that the young care leavers have spoken to us about. And so I'm sure that that was able to bring about change and ensure that the young girls are taken back to a safe environment and not just reintegrated back to the community for the sake of doing that. Thank you.
Thank you so much. Thank you. That was a very helpful, comprehensive answer. Next question was around, did the experiences of care leavers vary by the type of facility that they were in? And then the example given was kind of dormitory style facilities versus, I guess, smaller kind of halfway houses. Ken, I don't know if you wanted to take that one.
Sure, Emily. Kindly just ask that question again.
So did the experiences of care leavers vary by the type of residential care facility they were in? And the person asking the question was asking about the bigger kind of dormitory style facilities versus maybe smaller facilities, halfway houses was the term that they used.
Thank you for that question. I think the focus of the study did not encompass that. But I think what we found out that is closely linked to that what emerged is not even about the facility, but about the interactions between these children and the caregivers and the management. It is about those social relationships and support that children received within these institutions. So none of them, as far as I can remember, talked about the dormitories or the the structures within the institution. Yeah.
Hold on, sorry about that. We've just got time for one final question, which was around, was there any evidence on the preparation of families and communities for care leavers coming back into those families and communities? So was there any evidence of good practice of families and communities being well prepared for that return?
Yes, there were some evidence. I think in one of the counties, through the support of BCS, by the way, they were able to, at one level, engage the donors or the funders of the institution. And they got a buy-in of the donors. And then secondly, the donors supported community and family preparations in preparation for reintegration of these children. So there were sessions at the community, at the family and community level by the CCI staff. There were sessions with the area chiefs and the assistant chiefs. Yeah, so that's the much I can remember, but it only merged in one of the counties we visited. Thank you.
Thank you so much. I think Catherine wanted to add to that. Go ahead, Catherine.
So I want to add that moving forward within the care reform implementation, as I think one person mentioned about the guidelines, the national guidelines for case management for reintegration, and the government through Department of Children's Services and National Council of Children's Services are trying to help with people engaged in the reintegration process, doing really professional work in terms of preparing the children and also preparing the families, and doing several visits before a child is returned to family, a young person. So yes, in the past and even to an extent currently, that preparation is not comprehensive. But the care reform strategy has given the country momentum of focusing on the way to do it in a professional way, in a way that protects the children and lives to the do no harm principle. And yeah, it's a journey, but it's there. It's been looked at, and also we are developing, or documents have been developed on how to communicate to children generally on the care reform and government policy of returning back to families and to communities.
Wonderful.
Yeah, but it's a journey. We are not yet there yet.
Yeah. Thank you,
Yeah.
Catherine. And just to say that we have a case study on from the learning platform on the reintegration of children in Kenya. So demonstrating the value of that approach with more preparation and follow-up support being provided. Okay, I'm going to hand back over to Mona just to wrap up the webinar. Thank you so much for all the speakers. You did a really brilliant job. And I'll hand over to Mona. And while Mona's speaking, I'm just going to launch a quick poll that will help us to find out who's in the webinar. So I'll do that now, and then Mona, you can speak while people are filling that poll in.
Thank you. Thank you so much, Emily. And indeed, I want to echo your words to thank all the speakers, all the presenters we've had today, starting off with Mr. Kennedy Owino of National Council. But still, we managed to hear your presentation. And thanks to Catherine Kimotho of UNICEF Kenya Country Office for stepping in whenever called on, and also for providing insights from this research conducted in Kenya. Also, I want to thank the two researchers, Ken Ondoro and Betha Lutome of Child Frontiers, and particularly to Betha, who played the two hats there as a caregiver herself, but also a research and an assistant of Child Frontiers for this piece of work. We thank you so much for your insights and for sharing this important research that was rolled out in Kenya on the need to assess the needs of caregivers, and most importantly, to implement the findings and put in place structures that will help really address the needs of caregivers instead of just drastically closing and exiting them by the time they turn 18. Something that I've learned a lot on. So thank you all very much. Last but not least, of course, to you, Emily, as our lead consultant of Child Frontiers, thank you for preparing this session. It has been really informative, and it was really great to have the different speakers coming in. That has really helped us to get different insights. As Emily has already shared the short poll, I'm kindly again reminding you to complete this poll. during this time. Make sure that you fill it in because we want to hear from you. We want to see how best to improve these sessions. We have a new paper on climate change and care reform, and of course Bertha kindly put that link in the chat box in case not done, so that people can access, there we go, the new paper on climate change and care reform, something that is with us, the climate crisis, the poly crisis, as a recent UNICEF research has indicated, where there are multiple and simultaneous shocks and crises happening at the same time, which have a severe impact on children and women, including the care of children in our region. The next webinar, how do we access the poll? Somebody asked.
Oh, sorry,
Emily,
we've had to stop the poll. Sorry about that. So don't worry, thank you. We stopped it a little bit prematurely. I don't think I can relaunch it. But if you can introduce yourselves in the chat box, that's really, really helpful as well. And did you want me to mention the next webinar?
Yeah, the next webinar will be in July on case management processes and care reform. And of course, to get this and future webinars information, complete a short form that's also going to be put in the chat box so that you can receive directly information about the care reform learning platform for East and Southern Africa. You can also find other publications on the website for the platform. And have several new publications. Please take a look at the link that's also being provided. For UNICEF SRO, we're still in the process of updating our SRO public website. And once that has been completed, we'll also be sharing that link with you. So with that, I thank you all very much. And back to you, Emily, in case you have any additional final word.
Nothing more to add. Thank you, everybody. Great webinar. Hope to see you at our next one in July. Bye.
Bye-bye. Thank you.